If food suddenly tastes metallic, bland, salty, or just wrong after radiation treatment, you are not imagining it. This is called dysgeusia, a change in the taste perception, and it is one of the most common side effects after treatment for head and neck cancer. I'm Lauren Meffin, a speech pathologist and certified lymphedema therapist. Here is what most patients are never told, that it's not just about the taste buds. Patients often describe this in a very specific way. Everything tastes like cardboard. Meat tastes like metal. Nothing tastes sweet anymore. Water even tastes off, or food just feels like it has no flavor at all. This can be frustrating because eating is no longer enjoyable, and sometimes it will lead to weight loss, reduced appetite, and avoidance of family gatherings altogether. So let's break down what is actually happening in your body. Taste is controlled by tiny structures on our tongue. These are called taste buds. These taste buds contain specialized cells, and those detect 5 basic taste sensations: sweet, salty, sour, bitter, and umami, which is like a savory or protein-based taste. Here's what most people don't realize. These taste receptors are constantly regenerating. They typically turn over about every 7 to 14 days. Radiation disrupts this process. When radiation is delivered to our head and neck region, it can damage rapidly those dividing taste receptor cells. It can alter the nerve signaling that carries the taste information to our brain. It can also reduce the blood supply and slow cellular repair in our mouth. These changes to the structures, as well as the oral environment itself, result in big changes during mealtime. So even the tongue looks normal, the function is disrupted at the cellular level. But taste changes are not just about taste buds. Saliva plays a huge role in how we perceive flavor. Saliva helps to dissolve food particles. It helps to carry taste molecules to the taste buds. It protects and it lubricates oral tissues. It maintains a healthy environment inside our oral cavity. After radiation, the salivary glands are often affected. This leads to dry mouth called xerostomia. When saliva decreases, food does not dissolve properly, flavor molecules do not reach those taste receptors efficiently, and everything begins to taste muted or distorted. This is why patients will often say to us, "I can smell it, but I just can't taste it." Now, in addition to taste buds and saliva changes, radiation will also impact the nerves. Nerves are involved in the taste perception. Taste signals are carried through several cranial nerves, including our facial nerve, our glossopharyngeal nerve, and our vagus nerve. These nerves transmit information back and forth from our mouth to our brain, helping us to identify what is it that we are tasting. When the pathways are irritated or affected by treatment, taste perception can become altered, slowed, or distorted. One of the most common questions is, will my taste come back? The answer is often yes, but not quickly. Many patients begin to see gradual improvements around 3 to 6 months after treatment, with continued recovery up to 12 months. And in some cases, those taste buds will last even longer. But recovery depends on the radiation dose, the salivary glands involvement, the overall oral health of our patient, and their individual healing response. What can patients do? Well, while we cannot instantly fix these taste changes, there are strategies that can improve eating and quality of life. First, moisture matters. Keeping the mouth as hydrated as possible helps flavor perception. Second, flavor enhancement. Many patients find that stronger seasonings, tart flavors like citrus, if tolerated, herbs and spices, and temperature variation in foods can stimulate remaining taste functions. Third, oral care is essential. A clean mouth improves taste signal clarity. This includes regular brushing, tongue care, and dental follow-ups. Lastly, saliva products can help to support or make a meaningful difference in the comfort of our oral cavity and the ease of our eating. Most importantly, working with your speech pathologist or oncology rehab specialist can help to ensure swallowing, nutrition, and oral function are all supported in your recovery. Dysgeusia is not a small side effect. It affects nutrition, enjoyment of food, social eating, overall quality of life, and many patients describe it as one of the most emotionally frustrating parts of recovery because food is connected to everything in our life: comfort, culture, and family time. If this is you, you are not alone, and this is recognized and expected as part of the healing process. Taste changes after radiation are complex. They involve taste buds, saliva, and nerve pathways. But there is real potential for improvement over time. If you are experiencing dysgeusia, please know it is part of the healing process after radiotherapy. We are here to support you, and we will continue to make videos, and we will see you in the next one.